Welcome back. This Saturday, Dr. Romi Chopra is hosting a free virtual discussion about a health issue that a lot of women face, and that is fibroids. So he joins us this morning to talk a little bit more about this. Thank you so much for talking about it.
Thank you. My pleasure to be here.
So describe for our viewers, what are fibroids and how common are they?
So fibroids are benign tumors of the uterus. 80% of African American women, for example, will get that, and it's all during the childbearing stage. They land up getting pain, excessive bleeding. Some can be as big as a large pregnancy almost. And unfortunately, a lot of them are told to get a hysterectomy, which is absolutely not necessary. So we try to help them with minimally invasive options, for example, going through the wrist and blocking the blood flow to the fibroid.
What kind of options are we talking about that would be, separate from a hysterectomy?
Yeah, once you take the uterus out, there's no uterus left anymore, no childbearing, nothing else after that. So one of the options that we offer is we go in through the artery just at the wrist, and we thread a small catheter all the way down into the uterus and block the blood supply to the fibroids. That shrinks these fibroids, and patients walk home in a few hours, and versus having a full incision right through the belly, and having a lot of consequences from them. There are other options as well with robotics, etc. But again, those are all invasive versus what we do here.
Well, at what point does a woman know that, you have to do something? I have to imagine they start out and they're, minor problems at the beginning. I got to imagine, I don't know. And does it get worse? And how do you know when it's time to get help to do something about it?
Yes, I've had patients come to me where she's been bleeding 3 weeks out of the month. The mother usually is the center pin for the whole family. And if she's miserable, she can't go to work. I've had patients who were bleeding so excessively that they were changing 4 and 5 pads a day. So if excessive bleeding, excessive pain, they feel they're pregnant, but they're not. The excessive bulk, so to speak. And they usually will be told you have a fibroid and you need a hysterectomy. That's when they find somebody like me.
Yeah.
At that point, they need the right amount of information, not to go straight to a hysterectomy and get the uterus removed. That's when we know something has to be done. But usually they suffer for a long time before they kind of get help. So
Yeah.
we're trying to raise the awareness early to understand what the symptoms are and get the help early rather than waiting a long time.
Well, let's talk really quickly about the symptoms. What are the symptoms?
So heavy bleeding, a lot of pain, bulk, some get constipated, pain during sexual activity because of the fibroid being that big. Those are the commonest ones that they will feel.
Okay. Well, Dr. Romi Chopra, thank you so much for giving us this information, letting people know that there is an option besides getting a hysterectomy. That is, these other options seem like they're less invasive and maybe the recovery much shorter. Hey, thank you so much.
Absolutely. Thank you. Absolute pleasure.
All right. Have a great day.